Chickenpox, a common yet often misunderstood viral infection that affects people of all ages. Let's explore what chickenpox is, its symptoms, how it spreads, and most importantly, how you can protect yourself and your loved ones. What is chickenpox? Chickenpox, also known as varicella, is an infectious disease caused by the varicella-zoster virus, which belongs to the herpes virus family. It primarily affects the skin, causing an itchy rash and flu-like symptoms. Though chickenpox was once considered a rite of passage for children, the advent of the chickenpox vaccine has drastically reduced its prevalence. Symptoms of chickenpox. The first sign of chickenpox is often a fever, accompanied by a general feeling of fatigue. Soon after, a red, itchy rash appears, usually starting on the chest, back, or face. This rash progresses into fluid-filled blisters which eventually crust over, scab, and heal within a week or two. In some cases, chickenpox may also cause headache, loss of appetite, and body aches. How chickenpox spreads. Chickenpox is highly contagious and spreads through direct contact with the rash, as well as through droplets from coughing or sneezing. The virus can also spread by touching contaminated surfaces. This is why it's important for infected individuals to stay isolated during the contagious period, which can last about 1 to 2 days before the rash appears until the blisters crust over. The progression of the disease? Chickenpox typically follows a predictable progression. After the initial fever and fatigue, the rash appears, and within a few days, the rash transforms into fluid-filled blisters. Over the next few days, these blisters scab and dry out, signaling the end of the infectious period. Most cases resolve on their own, but the disease can be more severe in certain groups of people. Complications of chickenpox. While chickenpox is usually mild in healthy children, it can lead to complications, especially in adults, pregnant women, and people with weakened immune systems. Some complications include bacterial skin infections, pneumonia, and encephalitis, inflammation of the brain. In rare cases, it can also cause scarring or a long-term condition called postherpetic neuralgia, where pain persists after the rash heals. Treatment options for chickenpox. Treatment for chickenpox primarily focuses on relieving symptoms. Over-the-counter medications like acetaminophen can help manage fever and pain, but it's important to avoid aspirin, especially in children, as it can lead to Ray's syndrome. Antiviral medications, such as acyclovir, may be prescribed for severe cases or people at higher risk for complications. Calamine lotion, oatmeal baths, and antihistamines can also help relieve itching. Preventing chickenpox. One of the most effective ways to prevent chickenpox is through vaccination. The varicella vaccine is safe, effective, and has drastically reduced the number of chickenpox cases worldwide. It's usually given in 2 doses. The first dose is administered to children around 12 to 15 months of age, and the second dose is given at 4 to 6 years of age. Who should avoid contact with chickenpox? Certain groups of people should take extra precautions to avoid contact with chickenpox. Pregnant women who have never had chickenpox or the vaccine, newborns, and individuals with weakened immune systems are especially vulnerable to severe complications. If you think you've been exposed to chickenpox, it's important to seek medical advice immediately. Chickenpox and shingles. The link. Once someone recovers from chickenpox, the virus remains dormant in the body. In some cases, the virus can reactivate years later, causing shingles, a painful condition characterized by a rash of blisters, often in a band-like pattern. Shingles is more common in older adults and people with weakened immune systems. Myths and facts about chickenpox. There are many myths surrounding chickenpox. One common misconception is that it's not dangerous for adults. In fact, adults are more likely to experience complications. Another myth is that you can't get chickenpox if you've already had it, but the virus can sometimes reactivate as shingles. Let's look at some other myths versus facts. Chickenpox in adults? While chickenpox is more common in children, adults can also contract the virus. In adults, chickenpox tends to be more severe and can lead to complications like pneumonia, so it's especially important for adults to get vaccinated if they've never had the disease or the vaccine. While chickenpox is a common illness, it's essential to understand the symptoms, treatment options, and the importance of vaccination. By taking steps to protect yourself and others, you can help prevent the spread of the virus and reduce the risk of complications. At Vigor Moves, we're committed to empowering you with the knowledge and tools you need to take charge of your health. For more health tips, don't forget to follow us. Click the link in the description below to explore our range of premium supplements designed to support your wellness journey.